like what the reason why I believe that this is fixing my blood pressure is because I'm not taking any medication, and I haven't been taking any medication for about 45 days, and my blood pressure monitor keeps only 30 days reading. So in the last 30 days, I've had one day where the bottom number was 100. Everything else was better than below 140, but below 80. I mean, seriously below. And so not only was it not hypertension, but it's extremely healthy with no medicine, with no medication. And that's why I'm drinking some tea as well for the creatinine level. So my feeling is if the creatinine level maintained for all those years, right? It wasn't going up and down and up and down. It was kind of like not a good spot, but it wasn't terrible, right? Then with this therapy, with this medicine, there's no reason for me to think that anything other, and the readings. Sometimes my readings is like 100/60. Sometimes when I first started, I didn't know what low blood pressure was, so I thought maybe this is a problem. So I went and I investigated and researched low blood pressure. No.
How many years you been taking in medicine?
I've been taking the medicine for more than 20 years. I started taking blood pressure medicine when I was saving up for a house in the Washington D.C. area, and that was in the mid-90s. I was working on the weekend. I was working 7 days a
If
week.
you calculate for that price for medicines of those, it's going to be a lot.
Plus,
What do you pay?
It's so much better not taking the medicine because I had to. At one point, I took 3 medicines.
That's a lot.
And the nurse told me you shouldn't be getting readings of 150/100. You know, it's stressful because I was working 7 days a week. I didn't feel good with the medicine, and what they told me was the medicine. My blood pressure was too high to be on medicine.
Okay.
In other words, this was not right. Something's got to give because you shouldn't be at 145/85 if you're taking 3 medications.
So
my blood pressure was never where it should be. It was always borderline hypertension. Period.
Okay. And what do you think about my medicine? It will help your body and for your kidneys problem now?
Oh no, this medicine is totally different. Anything that's wrong with me feels better now.
Okay.
Okay. I had on the CT scan showed that I have an enlarged prostate, but I knew that not cancer, it's just enlarged. So some of the symptoms, and I could really tell because the capsules did the same thing. Then we had to discontinue that for a while, right? Having strong urges, having to get up 2 or 3 times every night, like most men over 50 or 55. Now, I mean, that doesn't happen. I sleep through the night, maybe sometimes get up 1 time. It depends if I had water or before.
I'm happy that our treatment is helping you to do all this.
Oh, it's unbelievable. Because it's undoing a lot of things. But the blood pressure, the high blood pressure causes creatinine levels. High blood pressure causes kidney failure and kidney disease. Okay? That's one thing I know. And so now I know that my blood pressure without any medication is unbelievably good numbers. There's no downside. It's not like, I mean, it was 1 reading, so it was an outlier. And that 1 reading was 125/100. It could have been how I had the cuff on. Because sometimes if the cuff is too tight, you'll get a high reading. I'm getting all these readings. The highest that I'm getting is well within the range of normal. Like when I'm getting all these 110s over 75, and then I'm also getting 90/60, you got to figure something's got to go wrong once, right? So,
That's right.
But if it's a high reading is rock solid, perfect, normal blood pressure without medication. A high reading for me now is going to be something like 130/75. And that
is nothing.
No, that's absolutely solid normal.
Yes.
So I believe that with my readings, I'm really curious because I'm positive I'm going to see more of a regeneration of the kidney and better creatinine numbers.
Okay, well, thank you so much, Terry. That was good for your body, and it's good for experience for everybody to learn how to use the medicine and how to use our medicines and use how you do diet and believe it what I do for you to get more healthy and longer life without use that stupid medicine of those for 20
No,
years.
what they wanted to do.
that.
Well, I feel fortunate. I feel kind of lucky compared to some of your other patients because this is a situation where my white cell count was okay.
Yes.
I'm asymptomatic. I don't have any bleeding. I don't have any swelling or pain.
Yeah.
And so, and what they saw on the CT was in one kidney. Now, what he told me just by looking, because I know the doctor, and he just said, well, I'm afraid that if we don't do a transplant, see, he's fast forwarding the whole thing. Take my kidney, and if it hasn't spread, or even if it did, I lost my train of thought. Cut that for a second.